Hi, my name is Christine Walsh, and I am going to be presenting my validation for setting up an IV. So the first thing I'm going to do is make sure I have the physician's order. Then I'm going to make sure I have the proper equipment, which I have set up over here. I have a basin, I have my IV stand, the proper tubing, the proper medication, gloves, and alcohol swabs. The next thing I'm going to do is go and introduce myself to the patient. While I'm in there, I'm going to be asking them how they are feeling, if there's any pain at the injection site. I'm also going to be verifying that this is the patient that I'm supposed to be caring for today. The next thing I'm going to do is wash my hands and also provide for privacy. So I've gathered all of my equipment, I've washed my hands, I'm going to put my gloves on as another layer of protection.
After I disconnect it, I will also get my syringe. I am going to aspirate. If it is greater than 100 ml, I will stop and discontinue, notify the physician.
I'm going to open up my medication bag
I'm just going to
and take it out.
and aspirate.
I'm going to make sure that it's the right medication that I need, and once I verify that, I'm going to put my initials, time, and date that this is being set up,
If it's less than 100 I can.
and the expiration date of the bag of the medication.
Then I will be getting
The next thing I'm going to do is I'm going to open my tubing.
tap water.
I'm going to unravel it.
That's about 30. I am going to gently flush it.
I'm going to unravel this. Okay. We have a little bit of a knot here, so I'm just going to untangle the knot quick. Alright. And I'm going to also put on the tubing my initials, the time, and the date that this is being set up. So the next thing I'm going to do
Connected to
is I am going to spike the bag. The first thing I'm going to do though is I am going to take this little blue cap off.
wash.
Okay.
Use my syringe. Then I will do
And I'm going to take this cap off of my tubing.
every 24 hours. I'm also going
I'm going to set this down.
to disregard my patient
And then I'm going to spike my bag.
for my INO and my nurse's notes. Thank you.
Wash our hands again, dispose of gloves properly.
And before I did this, I made sure that my tubing was clamped so that none of the liquid fell through. So now that my bag is spiked here, I'm going to hang it. Alright. So this is spiked. I'm going to squeeze this little tube right here to get the liquid going. I'm going to fill it up 2/3 or halfway. Okay, I'll get a little bit more in there. A little bit more. So this is about halfway filled. The next thing I'm going to do is I'm going to make sure that the end of my tubing is above my waist, and I'm going to let this drip into this basin here. I'm also going to undo my clamp. And I'm going to let this flow through so that the air bubbles can come down. I'm also going to make sure this cap at the end is undone so that the fluid can run freely through the tube.
Hi, my name is Samantha E, and I'll be doing the validations for the type 2. First, I'm going to go over the 7-point checks, which are
So this liquid is flowing through.
and provide privacy.
I'm going to be making sure,
I will be
checking the tubes for no air bubbles,
level.
and we still have a few.
Raise the bed at 45 degrees.
Alright, still checking. Alright, so we've run out of our air bubbles, and so the tubing is clear. We're then going to make sure that
I'm going to disconnect
I'm going to clamp the tube for a moment so I can get my watch ready so that I can calculate the drip factor, which is going to be 20 drops per minute, or 5 drops per 15
I'm going
seconds.
to check the patient for any nauseousness or any abdominal distension by looking to the bowel. I'm going to do that over the 4 quadrants from the left lower. The lower to the upper, then upper to the lower. It'll be the right quadrant. Now that I had to check them, I'm also going to check the placements just to make sure it's not dislodged or there's no infection or any drainage that should not be there. But it looks fine to me right now. So what I'm going to do is kink the tube so there's no backslash. Well, disconnect it. Then with my
Okay.
syringe, I am going to aspirate.
I'll let it run so that you guys can see that I have the 4 drops in the minute.
If it is greater than 100 mLs, I'm going to stop, discontinue, and notify the physician. But if I draw less than 100,
Alright.
I'm going to
So I have my
assess for any
needed drops per minute.
consistency, color.
The next thing I'm going to do, I'm going to clamp this to stop the flow before I attach this to the patient. So my clamp is going to be on again.
Fill my syringe with 30 mLs of tap water. And I'm going to slowly
Okay. I'm going to wipe down the port.
flush with 30 mLs of water.
Okay. So this is wiped off. I have my needed drops per minute. There are no air bubbles. And then in reality or in practice, I would be attaching this to the patient and I'd be taking the clamps off so that the medication can run freely into the patient.
I am going
And
to
that.
clean my syringe as I am going to use this for the next 24 hours.
I am also going to make sure
I am also
that my tubing stays above waist level,
my nurse's notes.
and
Before I leave the patient, I'm going to discard anything that is
I'm also going to make sure that the rail of the bed is up, so the patient does not fall out of bed. I'm also going to discard of this basin of medication, and then I'm going to clean up my equipment, wash my hands, and that would be it. And I would let the physician know that I have set everything up.
lower the bed at the lowest
And I would also, before I left the room, I'd make sure that the patient's okay, and I would place the call light right next to their hand so that they'd be able to call us if anything went wrong.